Good morning. It's 59 degrees at 8 o'clock. I'm Johnny London with today's lead story. The Norwich Hospital is officially closing its doors on this October the 10th after 92 years of service of caring for the mentally ill since 1904. The Norwich Hospital opened on the current campus on land along the east side of the Thames River, known as Brewster's Neck. The Norwich Hospital housed Connecticut's mentally impaired, employing at the hospital's peak of almost 2,000 workers, many from Norwich and surrounding communities. Norwich Hospital closed 10 years ago on October the 10th, 1996. First known as Norwich State Hospital for the Insane, it served the mentally ill in Connecticut for 92 years, but few knew what it was really like.
The community didn't understand what the hospital was all about. People think about seeing movies like One Flew Over the Cuckoo's Nest and other old asylum movies, and that's what they think of. That's not what Norwich Hospital was.
Remember when you ran away and I got on my knees and begged you not to leave because I'd go berserk? Well, you left me anyhow, and then the days got worse and worse, and now you see I've gone completely out of my mind. And they're coming to take me away, ha-ha, they're coming to take me away, ho-ho, hee-hee.
The bad things portrayed in these works, the abuses that were common at such institutions, did also occur at Norwich State Hospital. No one can deny that. But there also were at Norwich Hospital people who dedicated their lives to the care and understanding of the mentally ill. Dr. Christian van der Velde conducted research in the newly constructed Ribicoff Research Center.
You know, I'm very sentimental to the nursing staff in Norwich, because once I got a name for myself in my occasion, I was invited to give lectures, and I've seen quite a few state hospitals. And there's I feel so comfortable with that experience, how good the nursing staff was and their assistants. Not the nurses, the RNs, but also student nurses, or just nurses, or mental health workers as they were called. That I think you can give medications to patients, but it is who gives it with interest, with expectations, with hope, confidence, knowledge, and love. I always get, you may have noticed that, sentimental when I think back of these people who had so little themselves.
This form of insanity will require continuous treatment, and the patient must be kept under guard at all times.
Restraint is defined as keeping in check, to prevent from acting, and to deprive of liberty. Restraints were used throughout the Norwich Hospital's history. Fred Potter, a former psychiatric aide, explains how and why they were used.
Knowing everything I know now, I still think it was us doing what had to be done, because we had to provide a safe environment, not just for the staff, but we had 24 other patients up there. And again, these were people that, you know, they're in the hospital for their 15 days and they're out. And you know, you just couldn't have people getting hurt by patients that, for whatever reason, would not comply with what needed to be done. You know, assaulting other people. You know, we just couldn't tolerate that. You know, it just didn't seem appropriate to sit them down and talk to them after they just assaulted somebody. So, you know, it was a way of managing the unit to keep it a safe environment. Well, first of all, you had to put your hands on the person, physically restrain them, and then bring them over to a bed, and that's where we would use the restraints. So we take that ticking, we make the loop, secure the feet while people are holding the patient down, and then for the arms, in our downtime, we'd make the cuffs, and what they were basically was 3-inch wide adhesive tape, and you'd stretch that out, and you take 4x4s, and you'd put it on top of it, and then you'd put it back over it and seal it against itself. So, and what you did with that is you put the ticking across the arm lengthwise, and you put that cuff over the top of it, and you'd tape it with the adhesive tape. And it was very effective. And you know, that was one of the things the supervisors would check. They make sure they could get their finger in there, that it didn't constrict any circulation. And it was very effective. You know, I know at one point they changed the leather cuffs, but there was really nothing better than that method right there. That was very effective, and I think it didn't really cause any harm to the patient physically. Yeah, the person could be in restraints for 3 hours. Had to be checked every 15 minutes, I believe. And we would put them in a place where they were visible from the nurse's station. And I guess if looking back what I know now, if there was one criticism, that might be it, that the person was tied into bed in a hallway with everybody else milling about. But, you know, just didn't really have the staff to put them in a private room and have to sit there with them. You know, on admissions, it wasn't uncommon to have 2 or 3 people in restraints at times. You know, not many days went by when there wasn't somebody in restraints at some point during that 24-hour period.
The pathetic part about this song is that the suicidal precaution didn't change the way things happen. You come in the door, handful of hair, face down, body bag, whatever was going on, you did the best that you had to do with the situation. Drunken Jim, Detox Blues, the Cooch Man had the right idea. Cooperate, make life better. That's the way it happens. Are you rolling around again, old drunker Jim? You got a few years left and you're in a tailspin. You got the detox blues, Mad Dog's got you so confused. And there ain't no special precautions gonna keep you from this suicide. Could be a little bit lonely, depressed way down inside. Your life's gone by from a time to time. Can't shake off your addictions, they keep on driving you wild. While Irish rolls in the morning, while turkey for lunch. Your 2-fisted drinking's gonna shake up your life. And there ain't no special precautions gonna keep you from this suicide. Could be a little bit lonely, baby, depressed way down inside.
However, those who made it to the rehab program and were exposed to the idea of recovery often did get a second chance at life. Luis Martinez struggled with addiction for 25 years until his life became so unimaginable he attempted suicide. When he failed in his attempt, he sought treatment and got a second chance at life.
I was looking for something that give me some strength mentally, because my body was weak because I was using for so long and drinking so long. Mentally, to have something in my mind that might make me feel like keep going because I still want to go out. I still want to run out of there and go and get drunk. I still want to get out of there and go and get high. You know, it was very easy for me to do. But at the same time, I didn't want that anymore. I was there, and I was there. I wasn't wasting my time. So running around the building and see the cemetery right next door, I know I wasn't allowed to go in the cemetery, but at the same time, I always think about different things, you know, and I believe that go to the cemetery and leave all the influence mentally. Just say, I bury this in here. I bury the drug habit, the alcohol, my attitude, the way they think about people, the way that I live my life. Here I am, I'm only 39 years old, 38 years old, and I'm going to die very soon because the influence of drug and the alcohol. So here I am in the cemetery. I want to leave all this bad behavior here. When I jump this wall back while I was running, I want to look at life differently. I want to make sure that I bury all this bad behavior in the cemetery, because when you take people to the cemetery, you bury somebody in the cemetery, you never dig it back out. So mentally I did. I just went and jump in there, and I left all that in there buried. And my mind is still there. And my mind, it did work, and it made me feel good. When you bury something, you don't go back and dig it out again, so it's there.
Yeah.
Norwich Hospital was a caring, giving place, and it was a safe place. Many of these clients saw that as home and felt like they were being uprooted from their family and their homes and thrown out into the wilderness on their own, and they really were in many cases.
Norwich Hospital? No, I'm sorry, the hospital is closed.